In today's video, we are going to take a look at the drug paracetamol, its overdose and poisoning. Paracetamol is also known as acetaminophen, which is one of the most well-known and commonly used oral analgesic and antipyretic. It is available in the form of capsules, tablets, or syrups. Paracetamol overdose is common and may occur accidentally or in the context of self-harm. Significant overdose can result in liver failure if not promptly treated with an antidote. Just a few paracetamol tablets over the recommended dose can potentially cause fatal liver damage, and there may be no symptoms until it is too late for treatment to help. There is an antidote for paracetamol poisoning, and it is most effective within 8 hours of the overdose, so getting early help is essential. The recommended adult dose is 1 gram 4 times a day. Each tablet of paracetamol contains 500 milligrams. So that means maximum of 8 tablets daily. At least 4 to 6 hours should be left between doses. Paracetamol is mainly cleared from the body by the liver. The liver can only cope up with so much paracetamol at one time. The substance called glutathione is needed to neutralize the toxic breakdown components of paracetamol. If the glutathione runs out, then the toxic substances NAPQI build up and damage liver cells. Most people have few symptoms in the first 24 hours following overdose. These include feeling tired, abdominal pain, or nausea. This is typically followed by a couple of days without any symptoms, after which yellowish skin, blood clotting problems, and confusion occurs as a result of liver failure. Also, there might be additional complications, which may include kidney failure, pancreatitis, low blood sugar, and lactic acidosis. If death does not occur, most people tend to recover fully over a couple of weeks. Without treatment, death from toxicity occurs 4 to 18 days later. Some people take higher than recommended doses of paracetamol for pain over several days. They may not intend to kill themselves, and occasionally may not even realize they are harming themselves until they begin to feel unwell. Some people are at increased risk of liver damage from paracetamol. This includes those on certain medications such as rifampicin, phenobarbital, phenytoin, carbamazepine, and alcohol. Those who are malnourished, for example, through chronic illness or eating disorders, and those with alcohol-related liver disease, or just any kind of liver disease. Now, how is paracetamol overdose treated? I'm not going to elaborate on the treatment here, but the drug N-acetylcysteine is given intravenously. It protects the liver from damage. This may work via increasing glutathione levels. It is most effective within 8 hours of an overdose, but can be used up to and occasionally beyond 24 hours. N-acetylcysteine is given to people who have a certain level of paracetamol in their bloodstream. The main complication following a paracetamol overdose is liver failure. In this case, the patient may need to be referred to the specialist liver unit if the blood confirms liver failure. Urgent liver transplantation is the only treatment for this. Paracetamol is one of the most commonly used drugs available over the counter, which is persistently and heavily promoted by the catchy advertisements all around us. Shockingly, paracetamol causes hepatotoxicity even at therapeutic doses, which has led to some national formularies to recommend dose reductions. Paracetamol is advertised widely, but the information provided gives only the temporary relief benefits. The advantages and not the disadvantages, harmful effects, and the long-term consequences. So when you have some kind of pain which is not that severe, just don't think about taking paracetamol all the time. In case if you need to take it, read the label for instructions and take it at the recommended dose.